Did you know that most people with type 2 diabetes treat it the wrong way, often without even realizing it? It sounds shocking, but it's true. Millions of people focus only on lowering their blood sugar levels, forgetting what actually causes the problem. Today we will discover what modern medicine often overlooks, and it may completely change the way you see diabetes. If you have ever been told that you will have to take medication for the rest of your life, stay with me, because science is starting to show a completely different side of this story. Before we start, please remember that the information shared in this video is for educational purposes only and is not intended as medical advice. Always consult your doctor or healthcare provider before making any changes to your health routine. Unfortunately, the current model of treating type 2 diabetes is based on the fact that patients, either consciously or unconsciously, treat only the symptoms of this disease. In modern medicine, the treatment of type 2 diabetes focuses solely on lowering blood glucose levels. I would like to point out and remind you that the cause of type 2 diabetes is not an elevated blood glucose level, but insulin resistance, which leads to high blood sugar. So, the big question is, why to this day are we treating only the symptoms and not the actual cause of the disease? If you open any online source about diabetes, 99.9% of them clearly state that the cause of diabetes, I will repeat once again, is insulin resistance, which means the cells in the body do not respond properly to insulin. Insulin's job is to transport glucose into the cells so it can be turned into energy. When the connection between insulin and the cell is faulty, glucose, simply speaking, bounces off the cells, returns to the bloodstream, and raises its level there. And that's how the typical symptom of diabetes appears: high blood sugar. But again, too much glucose in the blood is only a symptom of the disease, not its cause. So again, the question arises, why even today do we treat only the symptoms of diabetes instead of its real cause? Let's take a look at how type 2 diabetes treatment looks today. A patient visits a doctor, the doctor diagnoses diabetes, and the patient receives a first-line drug, which they usually stay on for the rest of their life. It's called Metformin. For those who like a bit of history, let me remind you that Metformin was first used more than 100 years ago. And even today, after all these years, it is still the main drug used to treat type 2 diabetes. Interestingly, just as 100 years ago, the French doctor Jean Stern, who discovered Metformin, didn't know exactly why it worked in type 2 diabetes, we still do not fully understand the mechanism of this medication. Most evidence indicates that the drug inhibits glycogen synthesis in the liver. And glycogen, as a reminder, is made up of many glucose molecules. Thanks to this, people with diabetes achieve a better glucose balance, which translates into lower blood sugar levels. Unfortunately, we are still talking about glucose levels and not about insulin resistance, because the amount of data linking this medication to any meaningful impact on insulin resistance is, quite simply, very limited. So, to summarize what we've said so far, to this day we treat type 2 diabetes with a medication that was discovered 100 years ago. We know it lowers blood sugar, we do not fully understand how it works, and, to put it simply, everyone seems satisfied. The only problem is that the real cause of diabetes, insulin resistance, does not decrease in patients. On the contrary, it continues to grow. This causes people taking medication to notice that it becomes increasingly difficult for them to control their blood sugar levels. They often have to increase their doses just to keep glucose at the same level as, for example, a few years ago. But this is, of course, the result of the fact that insulin resistance continues to increase because the medications act only on glucose and not on insulin resistance. As a result, according to scientific studies, about half of patients will require insulin therapy within approximately 10 years of being diagnosed with the disease. So does Metformin really cure diabetes if half of people with diabetes need to start using insulin after 10 years? And looking at this situation from the outside, one might say that the patient has gained a kind of subscription to health. Because as long as they continue taking their medication, their blood glucose will remain relatively stable. If they stop, they will have to face the complications of diabetes. Before I go any further, I want to make one thing clear. The question may naturally arise, is it justified to use drugs that lower blood sugar levels? The answer is yes, Of course, it is very justified. Proper treatment of diabetes should indeed include reducing the symptom of elevated blood glucose levels using these medications in order to protect against complications. However, the priority at every stage of diabetes treatment should be to fight insulin resistance, because only in this way can we reverse type 2 diabetes. Now, someone might say, "Oh, come on, don't be ridiculous, you're talking nonsense. The internet says type 2 diabetes is incurable, a lifelong chronic disease." That's what my doctor told me too. What kind of confusion are you spreading here? Well, considering the availability and quality of knowledge from 100 years ago, when the first diabetes drug still in use today was created, and taking into account the quality of the information on which many current doctors still rely, often from textbooks from the 1950s, 60s, or 70s, I dare to assume that our understanding of insulin resistance has changed dramatically since then. Even a simple look at scientific databases shows that between 1950 and 1990, there were only 59 studies that described insulin resistance in any way. However, only a few of them even questioned the connection between diabetes and insulin resistance. But when we change the range from 1990 to today, we see over 1,150 results, meaning that more than 1,000 studies on insulin resistance have been published over the last 35 years. The real growth in research, as you can see, began around the year 2000. So in summary, it's only in the past 25 years that we have begun to gather real knowledge about the true cause of diabetes, insulin resistance. In addition, new data suggests that besides insulin resistance, the accumulation of fat in both the liver and the pancreas is closely linked to type 2 diabetes. Therefore, the well-known pathological condition called fatty liver disease takes on a completely new meaning in the context of treating type 2 diabetes. And to help you understand the importance of this information, I would like to cite a scientific study from 2019. The title of this study is Understanding the Mechanisms of Type 2 Diabetes Reversal. In its text, we read, "Clinical and pathophysiological studies have shown that type 2 diabetes is mainly a condition caused by excessive but reversible accumulation of fat in the liver and pancreas." Further, the study states, a primary care-based diabetes reversal study showed that 46% of people with type 2 diabetes could achieve remission after 12 months, and another 36% after 24 months, mediated by weight loss. Interestingly, as early as 2010, many researchers pointed out that fat accumulated in the liver is an independent risk factor for the development of diabetes, unrelated to insulin resistance. So, it is not only insulin resistance, but also the accumulation of fat in the liver and pancreas, even without insulin resistance, that can cause type 2 diabetes. I would like to present to you this scientific study, a 2010 study titled Liver Fat in the Pathogenesis of Insulin Resistance in Type 2 Diabetes. It states, in many prospective studies, it has also been shown that non-alcoholic accumulation of fat in the liver is an independent predictor of type 2 diabetes, regardless of obesity. To summarize this part of the episode, as you can see, achieving remission in type 2 diabetes is possible. This is not just my opinion. These are data supported by scientific research. From this point, I would like to share another very valuable piece of information for people who have been newly diagnosed with type 2 diabetes. If you are newly diagnosed, which in medical and scientific terms means less than a year has passed since your diagnosis, then, according to the studies I will mention in a moment, you have several times greater chances of achieving remission than those who have had diabetes for many years. And here I will once again refer to a scientific study, a 2016 study titled Remission of Recently Diagnosed Type 2 Diabetes with Weight Loss and Exercise. The conclusions read as follows. In individuals with recently diagnosed type 2 diabetes who were willing to undertake a structured lifestyle change program, 80% of those who completed the program and 67% of the total study population achieved at least partial remission of type 2 diabetes after 6 months. To summarize this episode, if you are newly diagnosed with type 2 diabetes, make sure to introduce changes to your lifestyle as soon as possible. Try to lose a few kilograms, stay physically active, and work on improving insulin sensitivity, which we will discuss in the next episodes. And for those who have been living with type 2 diabetes for several or even many years, please pay attention to the fact that reducing insulin resistance in your case can also significantly reduce the severity of symptoms and complications of this condition, provided that you start addressing the real cause and not just the symptoms of type 2 diabetes. So if you know anyone who has just been diagnosed with this disease, share this information with them because it may greatly improve their health. That's all from me for today. Very soon there will be more episodes about diabetes, insulin resistance, intermittent fasting, and healthy weight loss. You already know that health isn't just about treatment, it's about the choices you make every day. By subscribing to this channel, you'll get regular content to help you support your body naturally and responsibly. Join our community. Click subscribe